myself JV and Dr. Ravi Jain, Associate Professor and HOD, Department of Practice of Medicine and Faculty of Homeopathic Science at Jyoti Vidyapeeth Women's University, Jaipur. In this series of lectures, we will be discussing about various locomotor disorders related to the locomotor system, various diseases related to the joints, and we will be discussing about the most common disease conditions that we encounter, that includes osteoarthritis. We will be talking about rheumatoid arthritis, we will be talking about psoriatic arthritis, reactive arthritis, we will be talking about gout and many other disease conditions that is associated with the locomotor system. Now, locomotor system is a system that is related to the locomotion or the movement of the body. Whenever there is any disorder, then the movement of the individual is affected. The most common presentation that occurs in this particular disease condition is the difficulty in movement. Most commonly joints affected includes the hip joint, the knee joint, the metacarpophalangeal joint, the carpometacarpal joint, and so on, the shoulder joint. All these joints are involved. So today we are going to discuss one of the important disease condition, that is osteoarthritis. What is osteoarthritis? How it is caused? What are the various clinical features? What are the clinical features, investigations and management of osteoarthritis we are going to discuss today. So let us start with osteoarthritis. This is basically a non-inflammatory disease condition which is affecting the joints, and the changes in the joints that occurs in this particular disease condition are permanent. Osteo is pertaining to bone, and arthritis is inflammation, and arthralgia is pertaining to the bones or joints. So osteo means bones, arthritis to joints, inflammation of the joints. Although this itis is a misnomer, in this osteoarthritis, itis that involves the inflammation of the joint condition is basically a misnomer, because here osteoarthritis is a non-inflammatory disease condition. This is basically a non-inflammatory disease condition, but the changes here in this disease condition are permanent. Permanent deformed joints occurs in this particular disease condition. So osteoarthritis, a most common disease condition that mostly affects the old age individuals. This is very common disease condition, especially affecting the old age individuals, where this disease condition is occurring. The joints, we must have heard from the old people or the aged people present in our home that they are having joint pain, they are not able to move properly. So this is the most common condition, osteoarthritis, that we commonly see here. Now what happens in case of osteoarthritis? Suppose this is more common in the knee joint and hip joint. Suppose we take the knee joint. Suppose this is a knee joint. This is a knee joint, and this is basically a synovial joint. Osteoarthritis is mainly affecting the synovial joints of the body. What is the meaning of synovial joint? Synovial joints are those joints in which the synovial membrane is present. Here we have the synovial membrane. Now, what are the changes that takes place in case of osteoarthritis? In osteoarthritis, there are three major changes that takes place. Number one, there is focal loss. There is focal loss of hyaline cartilage. This is basically the hyaline cartilage. Hyaline cartilage. Hyaline cartilage, what does the hyaline cartilage do? Hyaline cartilage protects the joints from the shock, from the movement that is occurring in a joint basically. So hyaline cartilage, this protects these two bones. These are the two bones that is causing pressure. These are the load bearing joints of the knee joint. These bones, when they rub against, when the person walks, then these bones, they exert pressure against each other, and in order to avoid the friction, this cartilage helps the body to protect the degeneration of the joints. Now what happens in case of osteoarthritis is, in case of osteoarthritis, there is focal loss. There are three things that are happening in case of osteoarthritis. Number one, there is focal loss of hyaline cartilage. Alright, so focal loss of hyaline cartilage means that there is focal loss. There is loss of hyaline cartilage that is occurring at this particular place. Second point that is coming here is proliferation of new bone at the site of degeneration. There is focal loss of hyaline cartilage. There is destruction of this bony surface. Now when there is destruction of this bony surface, the osteophytes come and they start the repair process. Here the osteophytes are coming. Osteophytes are the new bone forming cells that are coming and starting the bone forming cells, because of which there is hardness of this area, that is known as subchondral sclerosis. Alright, there is proliferation of the new bone. Here the new bone is proliferating. That is the second step of osteoarthritis. And the third point that occurs in this case is the remodeling of joint contour. So what is happening here is, there is number one, focal loss of the hyaline cartilage because of the wear and tear. Second is proliferation of the new bone, and third is the remodeling of the joint contour. Now why it is known as osteoarthritis? Because there are formation of osteophytes. There is formation of osteophytes that takes place in the joint. Let me show you the mechanism using a PPT. This is the joint that I was talking about. These are the changes that are taking place. Number one, there is focal loss of hyaline cartilage. Here you can see, you can elicit the changes that are taking place in the cartilage. There is focal loss of the hyaline cartilage, and the surface beneath the cartilage, this becomes hard. That is known as subchondral sclerosis. Then there are formation of the osteophytes, and there is formation of the new bone. So first point was focal loss of the hyaline cartilage. Second point is proliferation of the new bone, and third is the remodeling of the joint contour. This takes place. There is also formation of osteochondral bodies. The changes, there are three types of changes that occurs in the osteoarthritis. Three type of changes includes the cartilaginous change, the changes in the cartilage. Second is the changes in the bone that we have already discussed, and third one are the other changes. In the other changes, there is changes in the synovial membrane. In the synovial membrane, this capsule becomes thick. There is capsular thickening, and because of this capsular thickening, the joints become stiff. Now, when the joint becomes thick, the movement becomes very much difficult. So what happens in case of osteoarthritis is, the joints, there is, and also another important thing is the muscles surrounding these joints starts to atrophy. There is degeneration of the joints that takes place. Alright, so what happens in case of osteoarthritis is, there is degeneration of the joints. Now, who are the people who are more prone for development of osteoarthritis? So osteoarthritis, this occurs in many people. This occurs in, number one, old age, age more than 40 years of age. Secondly, more in females. Alright, so in females this is occurring more. And third one, the third important thing that is occurring is, this is related to the internal factors like genetic factors, like obesity. These play a very important role. You can see the osteoarthritis runs in families, and obesity, these are the important factors that are responsible for development of osteoarthritis. Now, what are the clinical features? What are the signs and symptoms that are included under osteoarthritis? the pain and stiffness of the joints. As I have just now told you, there is pain because of the loss of the hyaline cartilage when the two bones are rubbing against each other. So pain and stiffness of the joint is felt. Crepitations. What are crepitation? The cut like sound. The cut when the joint is moved, then it produces a crepitation, crackling sound, that is known as crepitation. So there is pain, there is stiffness, there is crepitation that is felt in the bones. There is stiffness. This stiffness is for short duration, that lasts usually less than 30 minutes. There are formation of osteophytes. Alright, and the clinical features initially in the X-ray findings. Initially there are less changes, but as the disease is progressing, there is narrowness of the joint space. Alright. Now these clinical features can be elicited on the basis of three parts. Three parts means, number one, as I have discussed you, cartilage, the changes with the cartilage, the changes with the bones, and the changes with the other changes, that includes the changes of the synovium plus the changes in the synovial fluid, plus there is atrophy of the muscles. Because of the atrophy of the muscles, this atrophy leads to the development of antalgic gait. The changes I have already discussed with you. In the cartilaginous changes, there are focal loss of hyaline cartilage. In the bony changes, there is new bone formation and remodeling of the joint contour. And in the other changes, the synovium becomes thick. There is weakness and atrophy of the muscles, and also the joints become stiff. Now, how to investigate? Investigation of the case of osteoarthritis. So number one, we have the sign and symptoms. This disease is occurring late in age group. So we usually don't find these symptoms of pain, of stiffness in the early age groups. There is also history of trauma or injury is present. All right. So after the injury, there are joints, these are affected. Usually asymmetrical joints are affected in case of osteoarthritis. First of all, one joint is affected, then later on the other joints are affected. Second thing, from the clinical features we have just seen, then it comes to the X-ray finding. X-ray of the affected joint is performed. Usually AP view and the stress X-ray is performed to check for the changes. There will be reduction of the space between the joints that will be elicited in case of osteoarthritis. The third test we are going to see is full blood count, ESR and CRP. Since this is a non-inflammatory disease condition, therefore these values are usually normal and are not elevated in these cases. So in the investigation, mainly X-ray is done, the clinical features are seen, and the other values are usually normal. Now the management part. How to manage a case of osteoarthritis. Osteoarthritis is a disease condition that is very common these days. So this is a progressive degenerative disease condition. So first of all, we have to make the patient understand about the disease condition. So reassurance plus explanation of the disease condition. We have to tell the patient that we have to reassure him, we have to tell that what the disease condition is. Next, for relieving the pain condition, we have to give the non-steroidal anti-inflammatory drugs, that is known as NSAIDs. We can give COX inhibitors also. And in the advanced stage, when we cannot do anything, then many times intra-articular glucocorticoids, these are also given. So reassurance and explanation about the disease condition, NSAIDs and intra-articular glucocorticoids can be given. In the much severe conditions, surgery is advised. Surgery that is most common these days, which includes, in case of osteoarthritis, we have knee replacement surgery and hip replacement surgery. These two surgeries are very common these days because of the advancing age conditions. Now, homeopathic management. In case of homeopathy, a lot of homeopathic medicines are given based on the symptom similarity and upon the disease condition. Most common homeopathic medicines that are given in case of osteoarthritis are number 1, Arnica montana, when there is a history of injury and because of which the disease condition is progressing. Number 2, we have Bryonia alba, when the pain that is aggravated by motion. We know in case of osteoarthritis, the pain is aggravating by motion and is better by rest. In such condition, Bryonia can be given. Number 3, we have Causticum. Causticum can be given when there is drawing or drawing sensations in the joints. Next, Dulcamara. Dulcamara is again an important medicine that is given according to the weather. Next, we have Rustox. Rustox whenever there is early morning stiffness. Rustox is more indicated in case of rheumatoid arthritis, but also it can be given in case of osteoarthritis. Then we have sulfur. Sulfur, again a very important medicine in cases of the osteoarthritis when there is effusion, synovial effusion that is taking place. So these are the common medicines that can be given in case of osteoarthritis. So this was all about osteoarthritis. Let me again revise osteoarthritis for you. This is basically a non-inflammatory disease condition that is affecting especially the old age individuals. And there are 3 important mechanisms that are taking place in case of osteoarthritis. There is focal loss of hyaline cartilage, there is proliferation of the new bone and remodeling of the joint contour. Apart from this, there are various factors that are involved in development of osteoarthritis, that includes the trauma, old age, genetic factors. There are changes that are taking place. Pathophysiology I have discussed with you. When there are changes in the cartilage, there are changes in the bone, and the other changes that includes the synovium and the muscles, periarticular muscles. These are affected. That produces clinical features. Clinical features includes pain on movement and better by rest. Later on, the pain becomes constant, and especially there is very much pain at night. There is antalgic gait. The patient cannot walk straight. Initially, one joint is affected, most commonly the knee or the hip joint. Later on, these joints are increased, the number of joints are increased. The pain is there, stiffness is there, inflammation is there, but this is a non-inflammatory disease condition, so the inflammation is not very much marked. In the investigation, we have to check the family history, we have to check the history of the patient, complaints of the patients. Then we have to go for X-ray X-ray of the affected joints. AP view and stress testing can be done. The ESR, CRP and the other values are usually normal. In the management, we have to first of all assure the patient, and we have to give the full explanation about the disease condition. For relieving the pain condition, non-steroidal anti-inflammatory drugs can be given. For the deterioration, to prevent the deterioration, hyaluronic acid injections are given, intra-articular glucocorticoids can be given, and in the most advanced cases, surgery is usually advised. Homeopathy has a very important role in the management of osteoarthritis. That includes the very indicated medicine that includes Arnica montana, Bryonia, we have Causticum, we have Rustox, rhododendron, sulfur, and so on. So this was all about osteoarthritis. I hope you must have understood the session properly. We will be meeting in the next session with a new disease condition. Thank you very much. Have a good day.